Okay, hi everyone. Our study is on the effects of outreach group participation on the health of persons with Parkinson's disease, and I'm Sydney Carmen.
I'm Annalise Gebern.
And I'm Megan Sapita.
So, Parkinson's disease affects roughly 1 million Americans, resulting in around $52 billion in costs and expenses per year. And then PD is a chronic neurodegenerative disease with no cure, leading to a decreasing quality of life upon diagnosis. And research is currently being done to find alternative forms of treatment, such as dancing and singing, as opposed to medication. So the purpose of our study is to examine how outreach group participation affects the health of persons with Parkinson's disease. Our hypothesis is how will regular participation in one or more outreach groups per week will improve overall health, clinical symptoms, quality of life, cognitive mobility, ambulatory mobility, and sedentary behavior in persons with Parkinson's disease.
Our participant characteristics. So for our inclusion criteria, we have a diagnosis of Parkinson's disease between the ages of 50 and 85 years old, a mini mental state examination score greater than 24, have been on the same Parkinson medication for the past 30 days and enrolled in one or more outreach groups. For our exclusion criteria, we have an MMSE score less than 24 and any other psychological or neurological impairments. So for our study, for our recruitment, we are going to be recruiting participants in the neurophysiology lab. So they must fit the inclusion criteria, and we'll be recruiting through announcements in the outreach group. So this will include verbal announcements, the flyer, which is on the slide here, as well as follow-up emails.
Okay, so we'll talk a little bit about the methodology of our project. So I'm sure that most of you already know what these tests are, but we'll talk about it a little bit. So we're first going to be doing the Unified Parkinson's Disease Rating Scale, or the UPDRS, which for the purpose of our experiment will be used to measure clinical symptoms, since this test evaluates different symptoms of PD, which include motor and non-motor skills that are used in day-to-day life. We will also be using the Parkinson's Disease Questionnaire, or the PDQ-39, and in our experiment, this will be measuring quality of life, because the PDQ-39 assesses how often persons with Parkinson's disease experience difficulties or struggles across the different dimensions of the quality of life, which include things such as social support, stigma, emotional well-being, among others. And then we will also be using the Montreal Cognitive Assessment, or the MoCA, and this will be measuring cognitive mobility. The MoCA assesses for mild cognitive impairment by evaluating attention, concentration, memory, orientation to time and place, among many other things. We will also be doing two active exercise-based tasks. So first, we are going to be doing a 6-minute walk test, and this will be working to test ambulatory mobility. So our 6-minute walk test, you'll be walking around a track, and any participant who cannot walk or needs to stop and take a break, that's totally fine. You're not forced to just walk for 6 minutes if you cannot. So we will be using the Opals technology to record different kinematic data, and some of this data includes gait variability, swaying side to side, step length, and also your speed while walking. And then lastly, we're going to be using the ActivePal, and this technology measures sedentary behavior. So the ActivePal is a wearable technology, and it's going to be worn by our participants for two times during the duration of our study, a week at the beginning of the study and a week at the end of the study. And the ActivePal is really cool. It measures time lying, time sitting, standing, stepping, all moments of the day. So it's 24/7 data that we'll be able to collect. And then as far as our data collection process goes, so initially we're going to have our participants come in for their initial baseline visit, and that'll be at the beginning of the test period. So at this baseline test, our participants will complete the surveys and exercise tasks that we just talked about. We will also attach the ActivePal, and this session will last no longer than 1 hour. At the second visit, this will be the ActivePal removal, and this will take place 1 week after the initial visit, and we will record the ActivePal data from this week. And this will happen at an outreach event or outreach group, so our participants won't have to make an extra trip into the lab. We'll just be able to take the ActivePal off after an outreach group that our participant is participating in. Then we have our third visit at week 25, and this is the ActivePal attachment. So this this session takes place 1 week prior to the post-test, so almost at the end of the 6-month period. And this will also take no more than 10 seconds. We will attach the ActivePal again, which our participant will wear for 1 week. And again, this will take place at an outreach group as well. And then lastly, we have our final visit, which is our post-test at 6 months. So here, this visit will be conducted exactly like the initial visit. You will complete the surveys and exercise tasks. We will also remove the ActivePal and record that data, and this session will last no more than an hour again. And the whole time that this is going on, we ask that our participants in our study are also completing regular participation in the outreach groups for the duration of the 6 months. So most of you already do that anyways. So we just ask that you participate in 1 or more outreach groups, whether that's in person or online. We just ask that you come and join one of our groups. So then as far as our data analysis goes, we will be collecting data from all participants and their pre and post examinations, and we're going to run a t-test to determine if there's any statistical significance from this data. And for our 6-minute walk test, we will be scoring this based on how far participants walk in the time given.
For our expected outcomes, we expect that regular participation in outreach groups will increase the health of persons with Parkinson's disease. However, though, we could be wrong, but we may find that there's no correlation between the two variables, but we are hoping that we can find that. In future directions, we hope to be able to start collecting data in person following COVID safety procedures beginning fall of 2021. And then future studies kind of going off of this might address the interactions between physical activity, quality of life, and medication use in persons with Parkinson's disease.
So that is our presentation, and we would like to thank Brandon for being our graduate student mentor, and obviously Dr. Stegemuller as well. And yeah, we're hoping that some of you will volunteer to participate in our study since it's new, and we're looking forward to working with all of you next year, hopefully in person. So thank you for listening.
All right, let's give them a round of applause. I see some of you clapping already, but yes, thanks for that. I don't see any questions in the chat box, but we do have time for questions. So if you have any questions for Megan, Sydney, and Annalise, feel free to unmute yourself and ask away.
So can I make a couple of suggestions as someone who does statistical analysis all the time? I think you ought to be also asking people what exercise they do regularly outside of the outreach groups, and also what kind of mental activity do they do outside of the outreach groups, because those are two unobserved variables given what I hear the data you're collecting. I mean, there's probably other things you can do, but I think those two will, because it may be that you don't observe any effect, except that if you can control for other activities that people are undertaking, you might be able to detect an effect. I see Mark had his hand up.
Yeah, thank you for that. We're still trying to figure out all of that since our project is new, so we appreciate the suggestions.
I've got a question. We all know that this is a progressive illness, so how are you going to correct for the progression of the illness? And I mean, it's not the person with Parkinson's is not going to be in the same stage of illness 6 months from now. So,
Excellent.
So how do you correct for that?
Yeah, so that is something that we've been talking about with Brandon and Dr. S a lot, since we do know that um, disease progresses, obviously, like you said. We're also going to be comparing our data. We didn't really talk about this, but we're going to be comparing it to the Spark study that is happening in the lab as well. So we're going to be able to kind of look at the data from that, which is with newly diagnosed people and their progression, and kind of just compare the two. We're really still trying to figure it all out, so I wish I had like an even better answer. But hopefully when we are ready to actually test, we'll have all of this, all the fine details figured out.
I think the standard way of handling that problem of disease versus aging is to have that triune model where you collect from folks with Parkinson's disease, healthy older adults, and healthy younger adults. And then you kind of suss out if the effects are due to the disease progression or due to aging alone. So that's how they handle it in other studies. And we'll continue the discussion to see if that's appropriate for this study too.
Well, if I could add, comparing myself on Parkinson's to before I got Parkinson's, the progression is much more rapid, you know, relative to the amount of aging than it was before Parkinson's.
I appreciate that insight. Yeah.
I got one more thing. Because Mark's been doing this from the beginning, I think he would have shown a whole lot bigger change early in the program, because he's been doing it consistently for so long that even though we just think it's made all the difference in the world, we feel like it's one of the things that's kept us going. We're huge fans of these outreach groups, but I doubt you'd see quite as much change in him from the outreach groups as you would from somebody who hadn't been exposed to them before. I can't imagine that wouldn't have some impact on the results.
Exactly. That's a sort of gloss on what I was saying, that it's, I feel like I'm constantly running uphill. See, Mark is smiling.
Yeah, just like tagging along with what Megan said, we're going to be comparing ours to like the Spark study, which is going to like be testing with more like newly diagnosed people with Parkinson's disease. And then we also like in our questionnaires, it will like ask like how long have they had Parkinson's disease, so we can compare those who are more newly diagnosed and the effects of the outreach program on them versus the people who have had Parkinson's disease for longer. So
I think that's real important. I'm glad to hear you're doing that. And you might even want to look at how long your participants have been active in the outreach groups. That might be.
Absolutely. I was just going to add that. So thank you. Yeah, so not only how long you've had Parkinson's, but how long you've been in the outreach groups. Mm-hmm. And how, you know, and things about exercise, things about your exercise routine, your mental and physical exercise routines. I sort of think of the things I do mentally as part of my exercise routine. I see Aaron put up a 2-minute warning a little while ago.
Oh, good. Thanks, Aaron.
It's really that late. I have, no, it's not.
The 2-minute warning is for our speakers to let them know that we're getting close to their 15-minute allotted time. So we've got 10 minutes for each speaker for speaking and then another 5 minutes for questions. And I've got a timer going here too. So we do have time for one more question if you have one for these folks before we move on.
I wanted to say I have to leave at 3:30. I have a faculty meeting at 3:40. So just want to let you know I'll slip out.
Okay, thanks.
This isn't exactly having to do with the research, but I don't know if you can ask people just qualitatively because it's not statistical, but oh my gosh, it's the outreach groups make such a big difference in our just state of mind, our mental health. And I don't know at this point in the disease whether that would show up enough statistically. But like it's going to be hard to be without these for these months coming up, weeks and months, because we really depend on them.
Yeah, I would say that's one thing we really just want to highlight, like how much these groups do help, and any data that we can get to show in favor of our groups is going to be good with us.
Good. I'm glad.
So Mark, I've got a whole bunch of exercise videos that I've lined up, and I set a time each day to exercise, and I sort of randomly choose one of the videos so I get something different each day. I'll send you my list of videos.
Thanks.
Actually, I can, no, I'll send it to you. Yeah, I got your email. Okay, thank you.
Thank you. But it'll never be the same. We've tried to do that too, but there's something about this group that is extra good. So
there is.
Yeah.
It took me a long time sort of forcing myself when I realized that we're not going to be together this summer. I just forced myself to start doing that.
I've told many people we know who have Parkinson's that I'm just so sorry they don't live here where they can be a part of these things, because I don't think there could be a better place in the universe to have Parkinson's than here in Ames, Iowa, with access to Iowa State. So
yeah, in fact, with the programs, I tell people that I feel sorry they don't have Parkinson's. So that they
I wouldn't go that far.
to the program.
Well, these groups are open to anybody who wants to come see them. So if you're watching on our YouTube, on YouTube later on, the groups are open to all participants. You don't have to have Parkinson's disease to come and join us. But we do focus on serving folks with Parkinson's disease. With that, I think we'll go ahead and segue on to our next speaker. And I misspoke earlier when I gave you the agenda. Next up is Zoe. And this is Zoe on her own. So Zoe, you're welcome to go ahead and take it away.
All right. Hi, everybody. My name is Zoe, and I actually graduated last December, but I thought I would stay on and share some of my research. Can you guys see that okay?
Yes.
All right, perfect. So this study was actually funded by the Dean's High Impact Award, and I started it last summer. So we've been collecting for just under a year, and it is on COVID-19 impacts on exercise and quality of life of patients with Parkinson's disease. This was with Dr. Stegemuller, who you know, and I'm actually part of the psychology department. So the other professor on here is Dr. Allison Phillips from the psychology department. Okay, so just some background review for you. In a study from 2020, focusing on the impacts of COVID on Parkinson's disease, researchers found that the majority of patients experienced a significant decline in their general conditions due to the lockdown from COVID. One of the main reasons for this decline was the reduction of physical activity, as you might assume, and additionally, the interruption of normal routine. Only 50% of patients were able to continue with physical activity through technology. And as you guys know very well, physical activity is very important for people with Parkinson's disease. So a reduction of 50% is not good. Another study done in 2017, examining the exercise habits and perceptions of persons with Parkinson's disease, found that both people who participated in a high amount of exercise, more than 3 hours a week, and a low amount of exercise benefited from a significant other or personal trainer motivating them to exercise. Additionally, the number one barrier reported amongst the low exercise group was a lack of someone to motivate them. So that brings us to the current study. The study was an online survey evaluating motivation in individuals with Parkinson's disease in regards to exercise habit, exercise volume, and quality of life. We also examined some narrative questions about the overall impact of COVID-19 on exercise and Parkinson's disease in general. So, like I mentioned, it was an online study, and it was distributed through Qualtrics. There were no exclusion factors, and the only inclusion factor was having Parkinson's disease. If using a computer was too difficult, an option to do the survey by phone was made available as well. The survey was sent to a registry of people with Parkinson's disease from the US, as well as several other countries, mostly Australia. There was no identifying data, and all of the responses were anonymous. So we ended up with 123 participants, which is awesome. The average age was 72 with a standard deviation of 8.79. 60% of participants identified as female. 87% of participants identified as being white, with Asian and Latino or Latinx as the next two highest ethnicities, respectively. And like I mentioned, the study was sent to a general Parkinson's disease study participation list with multiple countries included, and locations were not collected to predict the location of participants. So I'm going to be talking about some of our measures now. We have four main ones: exercise habit, quality of life, exercise volume, and motivation. So first off, exercise habit. In the field of psychology, habits are behaviors that occur automatically in response to a conditioned contextual clue. Habits are important for health because they occur consistently and they are resistant to change. So this study measured exercise habit strength through the Self-Report Habit Index by Verplanken and Orbo. Next off, quality of life. We actually used the PDQ-8, which is a shortened and validated form of the original Parkinson's Quality of Life Scale. And this is just a short questionnaire that assesses the impact of Parkinson's disease on different dimensions of well-being and functioning. The third measure is exercise volume. So we measured exercise frequency using the IPIQ short form to measure minutes and days of vigorous and moderate exercise. Then by combining days and minutes of exercise, we created the measure exercise volume, which is the total amount of minutes exercised during the week. Lastly, we have motivation. So this study measured motivation for exercise with the Behavioral Regulation of Exercise questionnaire. And again, in psychology, motivation is the general desire to do something. So self-determination theory is one of the most well-evidenced and accepted theories in psychology today. And this theory splits 6 different types of motivation into 2 core types: external and internal. In this study, we did not measure a motivation, but we did look at the remaining 5 types of motivation, which I will now describe in further detail. So these are going from the left to the right, starting with like the weakest type of motivation and ending with the most internal or strongest type of motivation. So first we have external motivation. This is when behavior is done to receive reward or avoid punishment. So this only works for simple tasks, and since exercise is not a simple task, it is not very effective. The next is introjected. So this is an internal reward or punishment. So if you exercise, you feel really proud of yourself, but if you don't exercise, you feel really disappointed or like you let yourself down. In the middle here, we have identified. This means that the behavior is done because it is consciously valued to you. So you really consciously value exercise because you know it's important for Parkinson's disease. Next, we have integrated. So this is when the behavior is a core part of you, or a core part of your identity. So you identify as somebody who exercises. And lastly, we have the strongest type of motivation, and that is intrinsic. So this is when the behavior is done for the joy of itself. So you just love to exercise. So now moving on to my hypotheses. So the first one was that intrinsic motivation, which was the strongest type, is positively correlated with habit strength for engaging in physical activity, total exercise volume, and overall quality of life for persons with Parkinson's disease. And the second hypothesis is that individuals who participate in Zoom exercise classes, as opposed to traditional programs, will have a stronger exercise habit. So, analysis. All analyses were done through SPSS. A correlation analysis was used to measure the first hypothesis about motivation types and quality of life. The correlation analysis is a statistical method used to determine the strength of a relationship between two variables that are quantitative. Additionally, an independent samples t-test was used to determine the differences between those who participated in Zoom and those who did not. So, the results of the first hypothesis. So, intrinsic, integrated, and identified motivation were all positively correlated with exercise habit and vigorous exercise volume, which was the minutes of vigorous exercise done per week. So this is just a chart to help you visualize that better. So each one of these were the three highest types of motivation. They were all significant, and as you can see how the chart kind of leans down to the right as the motivation becomes more external. And then at the very far right here with external motivation, there's actually a negative correlation with exercise habit. So the other part of the first hypothesis was seeing if these types of motivation were related to quality of life at all. And we did find that external and introjected motivation were positively correlated with a poorer quality of life. So those who had a general external or introjected type of motivation had a poorer life in general. And lastly, a higher quality of life was positively correlated with exercise habit. So kind of forgetting about all the motivation stuff, higher quality of life, improves with exercise habit, which makes sense. So this means that the first hypothesis was supported. The top three types of motivation were all positively correlated with exercise habit and vigorous exercise. And the other two types of motivation, external and introjected motivation, were correlated with an overall lower quality of life and were not significantly correlated to vigorous exercise. This indicates that reframing one's beliefs and eventual motivation towards exercise could improve both amount of exercise and overall quality of life. So, moving on to the second hypothesis, this was over Zoom. So this was measuring differences between individuals who participated in Zoom versus those who exercised in other ways. Exercise habit did not differ by group. So the mean difference in habit strength had a p-value of 0.82, which is not significant at all. This means that the second hypothesis was not supported, and that there was no difference in exercise habit between those who used Zoom or not. Implementing Zoom enabled people who could not attend outreach groups to access exercise, so that is obviously overall very good. And further research is needed to determine exercise habit as it relates to online exercise groups versus traditional exercise, since these online Zoom exercise programs are relatively new. A few limitations. The data was collected concurrently at one time, and the data was self-reported. And again, further research is needed. So now I'm going to be talking about some of the impacts from COVID on exercise. So only 3.5% of participants reported that they completely stopped exercising, which, if you'll remember the first background literature, this is much better compared to their 50%. So the other 96.5% continued exercising by participating in exercise classes at home, Zoom classes, walking, or other types of exercise. And 60% of participants reported attending a workout group over Zoom. So that's awesome. So we also asked some open-ended questions about the impact that COVID had on exercise. And here are some of the most common responses. People mentioned that they had a real lack of incentive and motivation to exercise overall. Some people mentioned that they had to stop going to the gym and they stopped normal exercising routines. And a few people actually got COVID, and that made it very hard for them to exercise. These are all negative, but people also mentioned that, you know, participating in these online Zoom classes, you know, it strengthened community and made them feel stronger. Now I'm going to be talking about some of the impacts that COVID had on Parkinson's disease in general. Sadly, a lot of people wrote that they had friends and family pass away from COVID, that they felt lonely, angry, fragile, or anxious, and, you know, that they were upset when noticing a physical decline. And so those things are all valid feelings, and, you know, now you know that other people felt those things too. But also, people said that they felt strong, able-bodied, resilient, and lucky to be alive and happy. So I know all you guys with Parkinson's disease are tough cookies, and we made it through. So thank you. Feel free to email me at zdgreen@iastate.edu if you have any questions. And now I'll open it up to all of you if you have any questions.
All right, let's give Zoe a round of applause here for a presentation well done. We only have time for one question for Zoe right now, and then we'll need to move on to our last group of presenters. So is there one question for Zoe today?
Never mind. Sorry, I had to put a mask on. We have a visitor in the house.
No, that's, yeah.
He's talking to me.
And I actually have both my shots.
So do we.
They're all done. I was done with my second one almost 3 weeks ago now. So.
Oh, that's okay. Okay, seeing no questions from the floor, we're going to go ahead and turn it over to our next group of presenters. We may have a little bit of time here after our last group for more questions for Zoe if you think of any. But let's go ahead and turn it over to our UPDRS study with Jenna, Hannah, Yara, and Durga.
Right. Share here. All right. Hi, everybody. My name is Jenna Johnson.
I'm Durga Sridharan.
And I'm Yara Salty.
And our research has focused on the effect of virtual group therapeutic singing on Parkinson's disease. So a little bit of background information. As you all know, the Iowa State Neurophysiology Lab hosts many different types of groups for persons with Parkinson's disease, and we have singing, yoga, and boxing going on right now. And again, as you all know, due to COVID-19, these outreach programs have moved online, and our study has focused on the online singing outreach program.
All right, so our study focuses on effectiveness of online group therapeutic singing, so the outreach groups that we do, and we are comparing those to the in-person therapeutic singing, so when there were in-person outreach groups. Data from another study within our lab concerning in-person group therapeutic singing has shown improved motor symptoms for persons with Parkinson's. So we would basically like to know if the benefits of in-person therapeutic singing on acute motor symptoms are similarly seen in those participating in the online outreach groups that we've been doing this past year because of COVID.
So our hypothesis for this study is that virtual group therapeutic singing will show similar improvements in motor symptoms compared to the in-person group therapeutic singing. So results from this study have the potential to demonstrate the effectiveness of virtual group therapeutic singing in managing the symptoms of Parkinson's disease. So for this study, we have a couple of inclusion and exclusion criteria. And so the first thing is that our participants must be diagnosed with Parkinson's disease. They should also be between the ages of 60 and 90 years old. And then they also must be on the same Parkinson's disease medication for the last 30 days, and they must obtain an MMSE score that is greater than 24. So to dive in a little deeper on the types of measures that we'll be using, the first one that I briefly mentioned in the last slide was the MMSE, which is known as the Mini Mental State Exam, and this is just used to establish a baseline of cognitive functioning. Then we will have a demographic questionnaire, and so this allows us to look at other factors between the individuals participating in our study, and we'll look at things such as their education years, how long they've been in the singing group, and how long they've had Parkinson's disease or experienced symptoms. And then lastly, we have the UPDRS, which is the Unified Parkinson's Disease Rating Scale. And this is used to rate the movement ability within people with Parkinson's disease. So to go in a little deeper on the UPDRS that I mentioned earlier, this stands for the Unified Parkinson's Disease Rating Scale. And as an overview, this is a rating scale from 0 to 4 that accounts for the progression of Parkinson's disease through 4 different parts. So the first 2 parts are the non-motor and the motor aspects of experiences of daily living. And these 2 parts are just surveys, so they give examples about the types of questions, including if you've had any problems with remembering things or following conversations, or over the past week, have you had problems with your speech? And then we have the third part, which is the motor examination. And this one is heavily focused on in our study. And so the tasks that our participants will be evaluated on include speech, finger and toe tapping, arising from a chair, posture, rest tremor amplitude, and then gait and walking. And then lastly, we have part 4, which is motor complications. And this is just studying the functional impacts of dyskinesias or the impairment of voluntary movement. So here we have an example of UPDRS rating scale. This one specifically is the finger tapping. So like I mentioned earlier, it's a scale from 0 to 4. So 0 means that they have no problem completing this task, while 4 means they have a lot more difficulty with the task. So as you can see, it gradually goes up to from normal to severe, and 4 just means they can't or they can barely perform the task. And then overall, lower UPDRS score is better, and so that means they have better motor symptoms. And then a higher UPDRS score means that they have more difficulty within these symptoms.
All right, I'm going to get into the methods over here. So I just want to reiterate that all the data collection and testing was done through Zoom, video calls, and this is because of COVID-19 and everyone's safety. So to start out, 1 hour prior to the outreach group, which is the singing one, all parts of the UPDRS will be performed and scored. We are excluding the rigidity and postural stability portion because this isn't possible to do because of the online data collection. And along with that, if determined unsafe, the walking test will be skipped, but this does vary from person to person. And then our participant will attend the hour-long outreach group in the neurophysiology lab. Most of the participants go every week, so they're familiar with this. And then immediately after, 30 minutes after, and 1 hour after the singing group, part 3 of the UPDRS is scored. And between the scorings, the participants will be asked to sit quietly and read so they don't perform any other activities. And then when we go back to score them, the scores were blinded, so the videos were coded, so we did not know which portion of the data collection we were seeing to prevent any bias. And the members of this group did the scoring, and we did it so the members that didn't collect the data scored, and vice versa. So here's some of our data. For participant 1, we can see that they experienced varying scores, but they did show an overall decrease in the UPDRS part 3, which indicates an improvement of motor symptoms. Participant 2 also showed very similar trends, so they had an overall decrease in the UPDRS part 3 scoring, which also shows an improvement of motor symptoms. And then lastly, our third one showed an opposite trend from what participant 1 and 2 showed. So they showed an increase in UPDRS part 3 scoring
immediately after the outreach group, which indicates a decline in motor symptoms. So this could be an outlier. We will need more participants in the future to get a better understanding of what the trends are.
So this is the average overall results of all of our participants. Like Yara just mentioned, we've only had 3 participants so far, so this isn't a great representative set of data for us, but hopefully we'll have more data collection over the summer. But overall, we've seen an average decrease by 2 points in the UPDRS after the virtual singing group, which is really encouraging, and that's showing us that the singing group is improving motor symptoms. And then after the initial post collection, the scores kind of varied. So in post 2 and 3, those scores vary just a little bit. Some of the limitations of our study is mainly because of online data collection. Sometimes video quality can cause accuracy issues within UPDRS scoring, but like Durga and Yara mentioned, we do have multiple people score each video, so the scores are average. So hopefully that can resolve any outliers that may occur. And then not all of the parts of the UPDRS can be performed due to not being in the same room as the participants. And like mentioned earlier, some parts may also need to be skipped due to safety concerns. For example, there is a walking task and a rising from a chair, and if we believe a participant may not be able to safely do that without help, we will just skip that part because obviously we aren't there to help. If something were to happen, if they were to fall, we aren't there to make sure that they're in a safe environment. Like mentioned earlier, we are comparing these results to some data that Dr. S has collected with the in-person groups that happened before COVID. And in that study, the data showed that 18 out of 25 of the participants had an average 2-point decrease in UPDRS score from before and after, which indicates improved symptoms. And our data is almost right on track with those numbers. We had 2 out of our 3 participants show an average 2-point decrease in UPDRS score. So this is really encouraging because results from this study have the potential to demonstrate effectiveness of virtual group therapeutic singing in managing symptoms of Parkinson's disease. And this would allow in the future implementation of virtual GTS in areas where individuals with Parkinson's disease may have limited access to care, such as those who live in rural areas. I know we talked a little bit earlier about how there's people who would love to receive, this type of therapy, but they don't have a group near them, or because of mobility issues, they can't drive themselves, they aren't able to get to the groups. But hopefully, results from this study, if they show that the virtual group is just as or almost as effective as in person, then this would be a viable option for those people who don't live around here or don't have groups available near them. In the future, we hope to have more participants this summer, and then like Dr. S has mentioned, our outreach groups will be moving to a hybrid format. So we'll have both in-person and online groups going at the same time this summer. And so then that will allow us to also collect data on online boxing and yoga. So hopefully eventually we'll collect data on boxing and compare the in-person participants versus the online participants and see if there are similar improvements in motor symptoms. And we'll compare the results from this data also to see if one of the outreach groups, such as yoga or boxing or singing, and which one has the most increase in or improvement in motor symptoms, or if they're all about the same. And then just a few acknowledgements. We want to thank everyone in the Iowa State Neurophysiology Lab, as well as our participants so far for helping with data collections and participating in the outreach groups. And we also want to thank Dr. S for guiding us in this project and always being there to answer questions and support us. Our citations. Now we can go to questions.
All right, let's give them a round of applause too for a job well done. All right, and I don't see any questions in the chat box yet, so we'll go ahead and open up the floor, and you're welcome to unmute yourself and ask away. And you can ask questions of this group or any of the groups that presented today. Go ahead.
I just want to congratulate the singing group. I was one of the 2 participants, and it was very useful. I wouldn't have thought that singing would make any difference, and maybe I was the one who didn't make any difference. I don't know, but it was fun to participate. So thank you. I was interested to see first how many people you had and whether there were going to be any results.
Yes, we appreciate you participating. Thank you.
So I'm going to sign off, and thank you all very much. This was terrific.
Thanks,
I'm
Betsy.
sorry about the guy. The guy who was here thought I was talking to him.
Oh. That's okay.
All right, so it looks like everybody is about back. So I'm going to turn it back over to our MCs for the rest of our program.
Okay, awesome. Well, hopefully that went well for everyone. So I believe next we're gonna show Tryu's video if he's ready to do that.
Yeah, I think so.
Okay, awesome.
Let's see. I made a documentary for my honors project, and it took 3 people who had Parkinson's. It was Mark Bladel, Mark Barrett, and Kathy. Yeah, I'll take those out. And it kind of it's about how the disease has affected their lives. And we will see if I think I remember how to make it work. All right, can you guys see that?
It's cut off just a little bit.
Okay, but you can still see most of it, all right?
You know, at first I knew I had something. And then when I found out, that was kind of devastating, but I thought everybody has something. And it could be a lot worse. And the only thing I thought is I don't want people to feel sorry for me.
It was one of my first ever big diseases where you have to assume that something bad is going to happen, something big is going to, and negative is going to happen in your life. There were times, I think, when both of us were kind of hopeless. This was before we learned there are things you can do about Parkinson's disease, and so it was kind of a hard time.
I've got to say, I've got to add that I was really devastated. I felt despair.
Disappointment is too soft of a word. When I found out from the first physician that I went to see that he was suspecting Parkinson's, my wife and I shared a couple of tears and hugged each other, and then we started looking at what we needed to do at that point.
Parkinson's disease is a progressive neurological disorder. It typically happens or occurs in older individuals, but it can occur in younger individuals. And the younger individuals, they call that early onset. but for the most part, it's people 65 and older that tend to begin to show symptoms.
First and foremost, I would say each individual is unique and each presentation is different. And the trajectory of the disease is also different. But typical motor symptoms we see are the slowness of movement, the shuffling of gait, the freezing of gait, even motor facial features such as we call it a mask face. So it's seemingly lack of emotion, lack of facial expression, kind of that expressionless facial feature. Even though the emotion is there, it's just not expressed very well through the face.
I still do a little shuffling of my feet, and when I'm not thinking about it, but I can walk more with less shuffling when I think about it. I do have some trouble with my handwriting.
I had a lot of symptoms, but it wasn't until I developed a tremor and did a lot of reading that we began to suspect that. And that was about 10 years ago when I was 66.
He had a tremor for a long time before that, but his grandparent, his mother, his aunt, real strong family history of a familial tremor, and so it kind of threw us off track. And even when I started suspecting Parkinson's, Mark felt sure it wasn't Parkinson's because we were just assuming this tremor. In fact, his neurologist still says he does have that in addition to Parkinson's. But it wasn't until finally I brought it up to his neurologist and she had him walk down the hall and she said, well, yeah, that does look kind of like Parkinson's.
The events that led up to my diagnosis, it was early fall of 2017. I asked Dr. Stegemuller if I could pick her brain about Parkinson's. And my dad had thought he had Parkinson's, but he had essential tremors. And we were talking and Dr. Stegemuller said, are we talking about you? She said, because I noticed you shuffle.
The major cause is a loss of neurons in a part of the brain called the basal ganglia, and those neurons produce dopamine. And when those neurons die, then that's when we start to begin to see some of the motor symptoms.
What Dr. Stegemuller refers to here is known as the leading theory behind the cause of Parkinson's. What it states is that there's an area of our brain known as the basal ganglia. Now that's responsible for our movement and our motor learning, or it plays some role in it. The basal ganglia contains brain cells that release a specific chemical called dopamine. When dopamine isn't transferred from one neurotransmitter to the other, eventually the cells stop working and they die off, and this is what causes the motor symptoms of Parkinson's, such as the tremor or the shuffling of gait, to initiate.
I think I feel them getting more and more. If I sit down at a table and write a note, my right leg will shake quite a bit, sometimes my right hand. And I don't know if you notice, my right leg shakes. But if I focus on something like spreading my fingers or pulling my toes back or just activating some of those muscles, then the tremors go away for a little bit. They'll come back. But yeah, I think I'm noticing them more and more, but it's really not enough to interfere with anything at this time.
I didn't begin with any tremors, and now I don't have any tremors as I define the word. I have some spasms occasionally when my leg will just kind of jerk, but that's all I have as far as the incidence of tremors. I would say that I don't really think that I have tremors, at least not to the extent that they are problematic for me. My voice is not as loud as it needs to be sometimes. And it's something that my wife will say, Mark, I didn't catch what you said. Would you say that again? She'll say something like that. And I realize that I'm creating somewhat of an extra burden on my wife to require me to improve my articulation and voice and loudness.
You're going to have to help me here, Deborah. The dizziness or balance is terrible. And
balance and change depth perception have been hard. And then add that to general weakness, just not being as strong as he was. Those things have been hard. One of the things that he's developed, I remember distinctly when I was first aware of his having a pretty dramatic lean like this. And it was a year ago last November, so that's quite a while ago. But he was actually leaning so far, I was afraid he was going to fall out of his chair. And one of our friends with Parkinson's had developed that lean. Otherwise, I wouldn't have recognized it as being part of Parkinson's, because a lot of people don't get that. Some people do. And Mark wasn't even really aware of it, but he became self-conscious about it when he saw how dramatically he was leaning.
But there is a whole slew of other impairments or symptoms with Parkinson's disease that we call non-motor or other motor symptoms, like difficulty with swallowing, speech. They also have difficulty with fatigue, sleep disorders, sleep difficulties, depression, anxiety, apathy, lack of motivation. So there's all kinds of other symptoms that come into play, which actually makes it a pretty complex disorder or disease to treat. Progression would be, the symptoms aren't that severe. Like, they're not interfering too much with daily life. It's just like, it's a little tremor and it's kind of annoying sort of thing. And it will usually be on one side of the body. And then as it progresses, will progress to both sides of the body, where you begin to see the motor symptoms. And then as you get to the more severe, will be if you need to use a walker or an assistive device. The most severe stage is no longer able to move about independently, and often cognitive impairment becomes more severe at the end stages, with maybe a little bit of dementia that sets in at the very end.
Driving, just that about killed me. I've had fun driving. I've had fun cars to drive.
Your cars.
Well, I had a 1940 Chevrolet Business Coupe, and then we had a Volkswagen Squareback and a Volkswagen Bug for a while. I had a Porsche, a Targa. And just this last year, 2 years ago, I gave up my Alfa Romeo convertible. So it's been fun cars, and I've really enjoyed it. And when I had to give up, I voluntarily gave up my license. I got scared of myself.
They looked at driving effort and amplitude and seeing if there would be carryover to function while performing a series of exercises and selecting specific functional items to do on a repetitive basis. And the theory is, if you drive effort and amplitude and you drive carryover, so have them practice it every day, twice a day, 2 times a day for 4 weeks, can they have can they carry it over without the cueing? So if I give you 5 things to do, maybe I make you put your socks on big, or maybe I make you pull a chair in big, or maybe I make you put your jacket on big. At the end of the therapy, can you tell me, you usually have a hard time reaching up to the cabinets, maybe because you're not reaching big enough. Can you come back and tell me, guess what, Celeste? I reached up big. Remember, we've been talking about this bigness, and I was able to reach for a cup in the higher shelf of my kitchen for the first time. And so that's kind of what we want. We want them to carry over those themes within their lives without us cueing them. And that's the LSVT big. But it was actually initiated in speech therapy, and then physical therapist said it's a motor thing, because speech was basically driving the volume, so getting them to be as loud as they can. And they said, hey, if it worked in speech, it sure can work with physical therapy because it's a motor function. And it did.
Well, I think I've done quite a few things. We've done quite a few things. And one part of that message about using lots of things, that means there is no single best thing. And there are things that we've done that I think have made the disease more tolerable. Deborah started out early reading everything she could find that involved the symptoms that I was having. And so knowledge helped. In another sort of category, a big thing that helped is we found ourselves, as we came to know more and more about Parkinson's disease, is that we sort of changed community. People that had Parkinson's disease had one thing to offer us that we couldn't get anyplace else, and that was sort of a personal vision of the disease. Each of us had different symptoms, but all of us were going through a process of having to change our life because the disease wouldn't let us do what we were used to.
Oh, just having that friendship and, being able to do things together, whether it's paddleboarding, walking, cross-country skiing, anything like that.
Well, actually, the only people that have Parkinson's that we have really met are the ones that have been in the outreach program.
It's certainly probably considered to be a subjective assessment, but I think that even if it hadn't, even if my activities had not resulted in any kind of change in the physical nature of my body, I guess you could say, even if that hadn't occurred, certainly the attitude and the positive aspects of those classes has been a very, very promising thing in my life as I go forward as a diagnosed Parkinson's patient.
All of the participants are talking about an outreach group run by Dr. Elizabeth Stegmore. These outreach groups consist of dance and music exercise. They do singing, they do boxing, and they do yoga.
They all treat different or targeted towards different symptoms. So if we look at yoga, we look at relaxation as a big one, reducing stress. But also some of the things that are inherent are the stretching capacity to help with rigidity, so stretching for rigidity. And then also, a lot of people maybe don't think about this, but learning how to get down on the floor and get back up off the floor safely, bending over and standing up. A lot of those things maybe seem not so challenging, but can be for a person with Parkinson's disease. And so being able to actually practice those in a safe environment like doing yoga is also very beneficial. For boxing, those would be really focused on a couple different things. One would be force, so in making really big movements, fast and forceful movements when you do the punches and the hitting. We do a little bit on footwork as well when we're in person. And also there's actually a cognitive component to it because there are about 12 different punches in boxing, and you have to know if they call an order out, you have to think fast and think about movement sequencing and what those are. And the challenge is, you know, balance and force and cognition all at the same time. And then dancing is going to be a little bit different, really working on movement sequencing, and it's one type of activity where you move backwards quite a bit and move to the side more than you would for like boxing or any other physical activity, which is actually very good because a lot of people with Parkinson's disease are afraid of doing some of those movements because they don't want to fall. In this case, when you're dancing with a partner, you have somebody there to support you and you can still work on those backwards movements. You can work on turning, moving to the side. And then again, it's a whole movement sequencing where you're learning new movements, new sequences of movements, which is also very good. And this is all on top of the standard benefits that you get from exercise with endurance and strength that would build. And then finally, there is singing, which is my personal favorite, my personal favorite group. And this one, you know, it's been interesting because when we first started, we did the study and it showed that it improved respiratory control and swallow, muscle activity associated with swallow. It can also help improve the voice, which are things that you would expect with singing. But when we ask participants and we do quality of life, we also see that participants really enjoy the singing and they feel less stressed. They feel like they have a better quality of life after singing. And then finally, in some of our more recent studies, we're trying to look under the underlying mechanism, but what's been interesting is that we looked at other motor symptoms, and there were significant improvements in some of these other motor symptoms just from sitting and singing. So people, their tremor was better. I don't know how to explain any of that. That's something that we're looking at, and hopefully we'll get a grant to explore a little bit more. But it seems that just sitting and singing can do more than what you might expect.
I just say keep moving, find ways that will help reduce the tremors. I find by doing yoga or even boxing, because I'm engaging my muscles, I don't experience the tremors as much.
The community came about through our awareness that exercise is literally the only thing you can do. You can take medications for symptom control, but literally the only thing that is absolutely known to help is exercise.
So you kind of want to stay ahead of things. Usually when people get their diagnosis of Parkinson's, there's a lot of changes that have occurred within the brain, as you probably know. And so getting ahead of things, so making sure that you get a physical therapist consult, get some education, know what your community resources are. So know if there's a support group, know what exercise classes there are in the community, know the impact of your diet on your medications, know the different side effects of Parkinson's. There's so many things that are impacted by Parkinson's that has nothing to do with PT. So how is your digestive system affected? How is your sleep affected? You know, a lot of people have components of depression with Parkinson's, sleep disturbances. So really trying to be as informed as you can so you can appropriately manage things and know what's coming from the disease process. But I think just going to websites like the Parkinson's Foundation is a good place to start to kind of know how to navigate through it.
My advice the first thing I would tell them, it's not the end of the world, and that life will go on. It will be different, but that doesn't necessarily mean that it's going to be worse. It could be the same, or it could actually be better. And that, you know, doing a singing group or a boxing group or things like that may not be everybody's cup of tea. And so, you know, if you can find a support community, that would be wonderful. And however that support is there for you, that is what I would recommend. Whether it be just your family is super supportive and you enjoy spending time with them, or you meet with your grandchildren, you go for bike rides, or you try to stay active. Or if it's joining an official outreach group or exercise group, whatever you feel comfortable with. But some sort of community that promotes physical activity in one way or another would be my #1 recommendation for something to do. But my advice would be that it's okay, and it's your life. It's a big change, and everyone totally understands that. But we also know that we can keep going, and it can be fun. It can be positive, and you can still meet some new people, wonderful people, and still have some wonderful experiences.
For me, one of the biggest helps in dealing with this disease has been the ability, in spite of the pain, in spite of the, or despite the embarrassment, all this kind of negative stuff, is that there are people in that community that taught me how to laugh about it, how to sit with it and not let it scare me.
Every day is different, and you don't need to necessarily think that your day is going to be a negative one. If you can look for the small things, it's pretty much a cliche, but look for the small things and recognize that your family and your friends are vital to keeping positive about your situation, and they will. They will.
Support that person, be positive. You know, you can read all about it, but not everybody progresses the same way, and
It affects everybody differently.
Right.
And it's a long-term thing, so you don't freak out because, you know, instantly something's going to happen, and, you know, you really have to think of the long term instead of worrying about right now. You know, you do what you can as long as you can.
It's like you're saying, disease, I know you're gonna win in the end, you know, I know you're incurable, but in the meantime, I'm gonna, you know, have a good time. And if I'm a little bit insolent when I speak about you, disease, you know, that's the way it's gonna be.
You know, like I said, everybody has something, and you know, I have Parkinson's.
I don't, and she's healthier than I am.
Oh, yeah, right.
When I first started this project, it was always about telling the stories of these people that I'd gotten very close with over the last couple of years, and I really just wanted to show how the disease has affected their lives. But slowly it turned into something so much more than that. It turned into their fight. It turned into their struggle. It turned into them showing me that the most amazing part of life is how we're able to fight through the hurdles it throws at us. And the fight is what this project really tries to exemplify. The fight they've had to go through, and the fight that they've inspired all of us to go through as well. Fate whispers to the warrior, "You can't handle the storm." The warrior whispers back,
I am the storm.
We are the storm.
We are the storm. The warrior whispers back, I am. The hope outweighs all my sorrow. I believe and the vast open sky shows me more what I could be. And the colors drip from you into me. In the wonder of the moment sticks to me. In the colors drip from you into me. In the wonder of the moment, rescue me.
All right, well, that was it. Yeah.
That was
Thank you.
extremely touching, especially after I've gotten to know so many of them through the group. And I thank you all.
And yeah, I just wanted to say thank you to Mark, and Kathy once again. I mean, this was invaluable for me, and just having you guys be a part of this was awesome. And I've had this idea for almost 3 years now, and just seeing it come to life and the way it turned out, I can't thank you guys enough.
Thank you.
Wonderful.
Yeah, thank you, Chirayu. It was a wonderful experience for us. So thank you for including us.
All right. I know we're running a little bit late, but I think it's worth it. Our final part of today is, I'm taking over. I shouldn't. This is Megan and Durga's job. What am I doing? I just wanted to tell Chirayu, awesome job. Awesome job. And I did, yeah, I cleaned myself up before I turned my camera on. Thank you for making me cry like a baby. All right.
Oscar?
I'm sorry, what?
Did you get your Oscar?
I haven't yet, but
And your A+?
Yeah.
I'll submit it to the Academy later.
There you go.
But also, for you guys, here is the YouTube link for the film. It's actually premiering in 10 minutes, so it'll be available for everyone to see on there. So yeah, I put it in the chat. So.
I think you want to send it to the everyone group. I think I sent you a message a while ago, and so you sent the link to me privately.
Oh, I see that.
Yeah.
There we go.
There
so I think it was
is.
my bad. Sorry.
Yeah, blame John. That's that's on it.
So that link, you can go in 30 minutes. It'll be live on our YouTube channel, and you can share it and watch it again. All right. Okay. Durga, Megan, we're going to be quiet. Take it.
Okay. Well, to follow that up is pretty hard. But we have a little senior tribute section that we'd like to do to thank all of our awesome seniors who are graduating from the lab. Dr. S, I know we're kind of running short on time, so do you want me to go through the whole thing still? Like with all the videos and everything?
I say just go for it, and if people need to leave, they can sign off as they need.
Awesome. So yeah, I'm gonna go ahead and share my screen. Okay, perfect. So if when you see your name come up, if you wanna go ahead and unmute and then just share your plans for the future and anything you'd like to say, that'd be awesome. But okay, so I don't think Jamie's here, but Jamie is one of our graduating seniors, and her post-graduation plans are to attend Concordia's University Doctorate of Physical Therapy program. And her favorite lab memory were a couple she couldn't choose. So she had singing Little Brown Jug, trick-or-treating during the singing outreach, and all of the long meetings with her research team and all of the jokes that they made. Julia, her post-graduation plans are to attend the University of Iowa's Doctorate of Physical Therapy program, and her favorite lab memory was when Wendy made her and Doug their costumes as the Three Blind Mice for their Halloween party and the dance outreach, and also all of the theme days in general during outreach groups and coming up with all of the fun dances. And I believe Nikki is here if you want to go ahead and share, otherwise I can read it.
Yeah, so my plans after graduation is this upcoming August, I will be moving to Boston to attend Boston University's Doctorate of Occupational Therapy program. So I'm very, very excited for that. It should be a good time. And then my favorite lab memory, I also couldn't choose. So I said sledding and having a snowball fight at Dr. Stegamore's house, which was in 2019. And then every single holiday extravaganza was so much fun. It made my heart so warm to sing everything we worked towards for the whole semester, and also getting to meet or just get to see all of participants' loved ones again, and definitely also to becoming so close with our handwriting sophomores group now. Obviously we're graduated, but there was a group at one point of about like 7 or 8 of us, and we definitely all became super close and are still in pretty close touch. So those are all my favorite memories. They're all a little different, but yeah.
Okay. Awesome. Thank you, Nikki. And then Tessa is another graduating senior, and her post-graduation plans are she's actually going to be staying in Ames, working as a sports science intern for the Iowa State football team, and also helping out in the lab. So you'll be seeing more of Tessa as well. And then her favorite lab memory were getting to know everyone and going to the lab socials at Dr. S's house. And then lastly, Triu, if you'd want to share.
Yeah, so I am going to be going to Iowa City to get my MD at the University of Iowa. And my favorite lab memory is when I performed stand-up for you guys at the extravaganza 2 years ago, I think. I mean, like I said it right here too, I think that's the best audience I've ever had. And hopefully one day when we're back in person, I'll be able to do that again. But yeah, I think, yeah, that was probably my favorite one.
Awesome. Thank you. Okay, well, we just wanted to do a little bit of a tribute to all of the awesome work you've done in the lab. So there's just some pictures and some videos to walk you down memory lane and say thank you. So first we have a note from Mark to Triu, and it says, congratulations on your upcoming graduation and specifically on your soon-to-be senior project. We had quite the time getting together virtually beginning in October and November and finally connecting in March. My technology shortcomings were definitely on display, but your patience and persistence saved the day and my contribution to the project. Can't wait till I see the finished project, and best wishes in any academic or post-academic careers you may pursue. All right. If you guys can't hear the sound for some reason, just let me know.
All right. To the seniors graduating this spring, thank you for all you have done for all of us during the yoga, singing, and dance classes. Doug especially enjoyed your patience and smiling faces when you were helping. I especially remember Julia being one of the 3 blind mice and that was so much fun at the dance class. I wish you all the best with your future plans, and I'm sure you will be successful with whatever you choose. All right, to the seniors.
This is for Jamie, Nikki, Julia, Tessa, and Chiryu. I am wishing you the very, very best upon your graduation. Have really appreciated all of your volunteerism and your hard work. I wish you the best. I do remember Jamie and Nikki and Julia doing boxing, and especially Chiryu when we were face to face. I always ended up with him going through sequences of the punches, and I remember laughing a lot, so that was good. But I wish you seniors the very best, and hope you stay in touch with Dr. S and your other instructors or professors. Let them know what you're up to. I know I appreciate it when I have students contact me again, and it's just fun, even if it's just to say hi. So wishing you the very best. Happy graduation.
It's interesting how everyone has their own talent, and it seems to me that they are a very good group that will be presiding over us and enjoying it. So I will just say thank you for all of the graduating seniors. Thanks a lot.
Hi, Jamie, Nikki, Julia, Tessa, and Triu. Greetings and thank you to you seniors who are graduating from Dr. Stegemoller's Neurophysiology Lab. I got my Parkinson's diagnosis in November of 2019. I participated in the boxing and yoga classes in person until the pandemic shut down the face-to-face programs in March of 2020. When Dr. Stegemoller set up the remote programs for Parkinson's patients, I participated in boxing, dance, and yoga programs. It's been a real bummer not to have more contact with these students because of the damn virus. Please know that even though we haven't had a lot of personal contact, your efforts on behalf of the Parkinson's patients are very helpful and are greatly appreciated. Congratulations on your graduation, and good luck and great success in your future endeavors. The end.
Congratulations, graduating seniors in the Parkinson's class. I just want to thank you for all your hard work. This has been so terrific for those of us who have Parkinson's. For me in particular, I was losing my voice, and I'm a teacher. So I was worried that I was going to have to retire. But it's coming back. It's not there completely, but it's coming back. And I just want to thank all of you for yoga, for keeping me limber, for boxing, for keeping me strong. So I look forward to working with the next group next year, and have a wonderful life. Congratulations.
I especially want to wish goodbyes to Nikki and Julia and Shirayu, the three of you whom I've gotten to know the best over the last several years. We've been together for this time, and I tell you, it's a true gift to an old Parkinsonian, the times we've had together. Nikki, I can't remember all the places where we have had activities together. Boxing, yoga, can't remember. I think I do remember, though, delightful lunch hour. We spent participating in one of your experiments. Were you the one who put all that sticky goo in my spare hair for the EEG readings? Even if you were not that person, I think I would still blame you because it is a fond and pleasant recollection. What I really remember about you, though, is your smile. That says to me, you're both involved, open, and glad to be where you are. And Julia, I've known you longer than anyone here. Since I knew your parents before I knew you, I've known you ever since you were tiny, tiny, up to now. When I think of you, I think of the world being in sync, the stars all lined up the way they should be. You've been born, you've grown up, making adult decisions, and you've established an occupational goal. You're poised, I think, and competent and ready to pursue professional training. Things in your life seem to be going exactly the way they should be. Oh, and Julia, the activity I know you best from is dancing. I sometimes breathe a sigh of relief that you were my dance partner only once or twice in the last several years, which means you could have sustained only mild foot trauma from dancing with me. And Shirayu, you are a class act. How you ever found interest in becoming a comedian, I'll never know. But you're good at it. With comedy and your video recording skills to fall back on if your day job of medicine doesn't work out, you at least won't ever go hungry. And I gotta tell you, I am especially happy that you will be starting medical school at Iowa, my alma mater, this year. So when I think of all three of you, I get a really kind of warm, fuzzy feeling. You make me happy to have known you. Even though I would have liked to have known you better, I know you all as clearly good souls. The future looks bright for all of you. Thanks.
Okay, this is just a Shirayu because I definitely know Shirayu best and pretty much the only senior I know very well, but Shirayu did the videotaping for a project Gabrielle did. So Shirayu's been in our home, which in these pandemic times seems very, very weird because almost nobody's been in our home. We moved and then the pandemic happened. So it feels like there's something more personal there. But I want to thank Shirayu for the project he involved us in because it was kind of hard work for us actually. Took a lot of time, but it made us look back over the years of Mark's journey with Parkinson's and kind of examine it, think about it, find some of the good in it. And same thing with finding all those pictures. I'm sure, Shirayu, you must have really been tired of me sending pictures after I finally got started. But it was a good experience for us, and I thank you for it. And we're looking forward to seeing your finished video sometime. And thank you all. We both love all the activities with the students, and we're glad for every one of you we get to know better.
Me, Nikki, Julia, Tessa, and Shirayu. Congrats on your graduation from ISU. Thanks for your friendship and all your volunteer hours. The smiles on your faces were like bouquets of flowers. When the pandemic came, we're glad that you stayed. You help us face unafraid the challenges that PD made. Nikki, you were quick to share your screen and your choreography. It was great to get to know you as you studied kinesiology. Julia, thanks for your thoughtful calls teaching me Ghostbusters. Try you, I'll remember you as a great comic and one of the great dancers. Best wishes for all your futures and for always being kind. Know that you made a difference in so many lives like mine. Me, Nick.
All right, so that was kind of emotional and everything. Actually, there's one more. I don't know why it didn't come up, but we'll end with some wise words from Keith. So hopefully this plays now.
Nikki, Julia.
Okay, maybe if I play it from here. We might have to watch it from here. Okay. Okay, I don't know.
Nikki, Juliet.
Oh gosh. I don't know why it's not playing even though it's like there. Anyways, I'll probably just figure that out after. And I'll share this video with all of the seniors and everyone so you guys can have the slideshow and all of the videos just for all the future. But we'd like to say thank you for everything you did for us. And I'm sure Dr. Stegmuller probably has some words for you guys right now.
What are you going to do, make me cry some more? Oh my gosh. So I know we're running a little bit over, so I don't want to take too much time, but I think you all know how much I love you all, and I appreciate all the work that you've done in the lab, and you know, we're going to miss you. But I know that you're going to go on and you're going to do wonderful, wonderful things, and you know, just don't forget where your roots are, where you started, and remember that even as a freshman, an undergraduate freshman, you were changing lives and helping people and improving lives, and just continue that as you move on. So good luck, and make sure that you stay in touch and come back and see us.
Yeah, well, with that, I believe that's all we have for you guys today. So, yeah, thank you guys for all coming, and we really appreciate it. Dr. S, are we good to go, or anyone have any last minute comments or anything?
I think we're good. Thanks for coming, everyone, and have a really great afternoon. Look for information coming out. We'll probably share all of the links from today and answers to Dr. Oken's questions, along with information coming up for our summer program. Bye, everyone.